So someone want to know about Bernoulli, which is a principle, and Venturi, which is an effect. So the Venturi effect is caused by the Bernoulli principle. So when we have a tube and it narrows like this and then expands again like this, as the fluid is flowing through that narrowed segment, the velocity will increase. And when that velocity increases through that narrowing of the tube, the person might hear the sound as a bruit. And they'll hear it like a whooshing sound, like. So for neuro-ophthalmology, one of the applications of this is patients who have pulse-synchronous tinnitus. Even though it's called tinnitus, it's not really from your ear. It's a bruit. It's a real sound. So to me, tinnitus is the sound the person hears because something in their ear that's making the ear hear a sound, but it's not real. So they have some Meniere's or something in their inner ear, and they hear a sound, but there's no sound. But a bruit, we can hear a bruit. So if the patient can hear the bruit and the doctor can hear the bruit, then that's a real sound. It's not a hallucination created by abnormality in your ear. So pulse-synchronous tinnitus probably is a bruit caused by increased velocity, and for us in neuro-op, that is in venous sinus stenosis, which is a common radiographic feature of intracranial hypertension, but especially in idiopathic intracranial hypertension. So in patients who have idiopathic intracranial hypertension, IIH, they often have narrowing of the transverse sigmoid sinus, and if it's on the ipsilateral side to their pulse-synchronous tinnitus, when the intracranial pressure is high, it collapses the sinus and causes the Venturi effect from the Bernoulli principle, leading to more rapid velocity across the stenotic segment, which the patient hears in their ear as a bruit. And because it's dependent on the pressure head, it is a pulse-synchronous tinnitus. It is a very good symptom of venous sinus stenosis in idiopathic intracranial hypertension, and we use it to judge non-invasively whether the patient has high intracranial pressure.